Hi, I'm Rodger Belcher with the Kids Hope Alliance. This presentation covers the basics of results-based accountability. Our objective will be to understand what turn-the-curve thinking is and how we can use it. We'll understand the distinctions between the accountability for the whole versus the accountability for a part. We'll cover one of the most important concepts, which is the differences between population accountability versus performance accountability. And last but certainly not least, we'll discuss how to select results, indicators, and performance measures. The origins of results-based accountability started with Mark Friedman and his book, Trying Hard is Not Good Enough, and its companion reader, Turning Curves. I personally recommend reading both to gain some really great insight as you drill down into these important and very interesting books. Key principles of the RBA framework include starting with the ends that we need to accomplish and then working backwards to plan the means to achieve those ends. At all times, our decision-making must be transparent and data-driven. First and foremost, make sure it's useful to managers and not a compliance exercise. Keeping it simple is one of the most important things we can do to effectively use RBA. Okay, so let's drill down into the concept of turn-the-curve thinking. I would like to start by using an analogy of a real-world issue that I'm faced with and how to turn-the-curve thinking can help. I should add that RBA is a process that should use common sense with simple language and should always use data-driven decisions. So as I stated earlier, we start with the ends. In this analogy, that would be for me to submit a weekly status report on time. The report is considered late after 5 p.m. on Friday. Historically, I've had a real challenge getting the report in before it's due. My forecast, if I don't do something, is that it will continue to be submitted late and I'll possibly not even get it done on some Fridays. So what's the story behind these late weekly reports? First, I'm responsible for a help desk team that administers a cloud-based information system that serves over 400 system users. That amounts to a huge variable. Some weeks it's slow, and other weeks it takes a full 40 hours for multiple people. Second, my team has taken on a number of new projects lately, which recently adds to the things that I need to keep track of for the report. And yes, COVID-19 precautions has made everything more challenging. One thing on the positive side is that my team now has a new part-time person, which has reduced some of the workload, and that gives original team members a little more time for housekeeping tasks, such as reporting their status back to me. So who can help or what would work? There are different options that could work. Leveraging my team more, dedicating more time to tasks, or even using a new software app. So what am I going to do? What would make the most difference, and is that action feasible? So I think that I'll provide a template and weekly deadline for the team to submit their reports to me that I will roll out into my report. I'll also reserve 15 minutes each day to work on my report and 30 minutes on Friday afternoon to add team members' reports into my department report. These actions are the means that I believe will turn the curve on the data. So turn the curve thinking emphasizes tracking our progress against our baseline trend. In other words, we compare how we are doing against our historic results and our forecast if we're to do nothing different. We implement our action plan and collect data to ensure we meet our goals. So with this action plan, I'll record when I turn in my future reports to confirm that my action plan worked. So now that we've seen a basic example, let's walk through the steps of using the 5 core questions of turn the curve thinking in the book. Trying hard is not good enough. Mark Friedman offers a set of 7 questions. However, we can accomplish our objectives with these 5 questions. Either approach works well. Whether we are evaluating a population indicator or a program performance measure, it's necessary to ask, how are we doing? Maybe things are going okay, but they could be better. Or perhaps things are not okay, and we really need to achieve better results. When satisfactorily answered, this question should lead to reliable data reflected on a trend line with a forecast of what happens if we do nothing different. That then builds a foundation to understand our current results based on data and guides us to using data-driven decisions as a means to achieve an improved ends. In other words, our action plan becomes the means to resolve the issues. However, it's critical to understand the story behind the curve. What are the root causes of the current trend? Are they internal or external causes? Are the causes permanent or temporary? Let's ensure we take action on root causes and not symptoms of those causes. We also need to look at who are the partners who have a role to play and that can help us to turn the curve. Can we engage them and collaborate effectively? We also need to look at what works to turn the curve. Answering this question can start as brainstorming. Look for new ideas. Ask what others are doing. Finally, let's put together an action plan. This will be the means to achieve our ends. We would expect it to include data collection in such a way so that we can confirm if we're turning the curve or not. And finally, we should be transparent about our decisions, actions, and objectives. And finally, we should be sure that we base all our decisions on real data. So let's drill down into each of these questions a little more now. And we can begin with, how are we doing? So to address this question, we should illustrate our baseline data in such a way as to create a trend line over a period of time. This baseline can reflect your empirical data, your observations. To show your forecast on the graph, show where you are headed or how the data can be expected to trend if there are no relevant changes to impact your results. The forecast would be considered the opposite of what would happen without applying turn the curve thinking. So we'll turn the curve when our action plan produces data that shows we're doing better than the forecast. We can use ROI, or return on investment, of our resources needed to change the trend line of the forecast. So now let's drill down into the question of what's the story behind the curve. As answering this is necessary to develop our initial forecast and to have a complete understanding of all the relevant factors impacting our results. To understand the story behind the curve, let's look at any restricting and contributing factors. Can we isolate or identify what is influencing our trend line slope? This can really be thought of as a force field analysis that will help us understand the factors that influence our situation in terms of pushing us toward or away from our goal. We need to understand the root causes of the restricting and contributing factors when we identify through force field analysis. A traditional method of doing this is by asking the question why for each cause until we find the root cause, which is the cause that is not dependent on any other causes. This can sometimes take up to 5 iterations of asking the why question for each underlying reason that explains the problem until the root cause is identified. We also want to include both factors and understand which are negative or positive so that we do not eliminate the positive factors that actually help us. Also keep in mind anticipated or future circumstances which could require changes later, such as policy or budget changes, and even demographic or national economic changes. When analyzing relevant internal factors, don't limit yourself to what is in your immediate control. Instead, also consider external factors. Those will often lead to opportunities which can be addressed with the help of partners. Once root causes have been identified, we need to prioritize them to support our strategic goals. In other words, we address the most important issues to our strategic goals first when possible. We should also consider if additional research will be needed to have a complete and thorough understanding of all relevant factors and circumstances. Ultimately, we need to have enough knowledge to ensure our strategies will have a probability of success solving the problem. Remember, too, truly understanding the story behind the curve without jumping to solutions. The process as described is important. Invest the time and thought to understand the story by getting to the real root causes from a system perspective. Avoid defining the root cause in terms of solutions. For example, don't jump to saying the problem is the staff does not have enough training. Without using the process, you can miss the deeper issue. Maybe the real problem is that the employees are not incentivized to follow the procedures. It's important to remember that your partners may have a critical role to play also, but in helping to turn the curve and in understanding the why and what of your action plan. When we ask this core question, we acknowledge that we may not need to do everything ourselves. Can we leverage our partnership, or can we work in collaboration with others to turn the curve? Don't just focus on traditional partners, but also look at potential new or non-traditional partners. Sometimes when we determine the story behind the curve, we can find that the root causes lead to external solutions which can only be addressed by external partners. Moreover, collaboration with partners is always important because it brings us a diverse perspective, which often increases the odds that we achieve a full understanding of all the dynamics of the story behind the curve and the factors impacting our trend lines. Now let's talk about brainstorming the question of what will work to turn the curve. A reliable way to start answering this question is with relevant evidence-based information from research you or others have gathered. You should also look for low-cost or no-cost solutions that can be implemented. Sometimes these may actually address a root cause or help facilitate part of the solution. Can we use our existing resources more efficiently? Is it possible we do things a certain way now because it's made sense years ago, and maybe those things have changed? Determine if you can do things differently with your current resources. Don't forget to consider the off-the-wall ideas. It's great to think outside the box or to list those crazy ideas that need unlimited resources. Sometimes the first crazy idea isn't practical, but something on the list might turn out to be not so crazy after all. Also, be sure to look for research from other sources and publications to identify best practices or great ideas that someone else has already implemented. Avoiding the reinvention of the wheel often saves time and money. Okay, so now we are ready to tackle developing an action plan. It will become the means to our data-driven objectives of turning the curve. When developing the action plan, remember to create and maintain an order of priority. You will also want to ensure that you use all 4 criteria to include leverage, feasibility, values, and specificity, otherwise known as reach. The who, what, when, where, and how questions work well for this. If you're specific about what will be done by whom, when, where, and how, then you can avoid a vague action plan. This will go a long way toward a successful implementation. To develop the details of our action plan, we can start by listing each category and then prioritizing them using the 4 criteria of leverage, feasibility, reach, values, and specificity. Any strategies with high in all categories are addressed first, or at least as soon as possible. This prioritization not only helps with addressing the most important issues first, but it also helps to address which strategies can be funded if there aren't enough financial resources to do everything immediately. Now here we see an example in which strategy 3 has been judged to have a high score for all criteria. If none of the other strategies equal that score, then it becomes the highest priority. To summarize turn the curve thinking, you should answer these 5 core questions. How are we doing? What's the story behind the curve? Who are our partners who have a role to play in turning the curve and thinking through the process? What works to turn the curve? And what's our action plan to turn the curve? When you share the finalized action plan with others, you won't necessarily need to discuss the details of all 5 questions. Instead, you can efficiently describe the action plan based on just these 3. So how are we doing? Using a graph that shows a forecast where the trend line will go if we don't do something different. Then cover what's the story behind the curve. You'll want to describe the story behind the curve with prioritized actions. And then you want to cover the action plan to turn the curve, describing the action plan with strategies that have been prioritized. Be dynamic. Always remember that turn the curve thinking is a dynamic process that may need to change over time. Be on the lookout for new information in regard to how we are doing. Regarding the story behind the curve, realize that you could get new information or new factors that might change the story behind the curve. New organizations or people could become strategic partners, or existing partners could end their collaboration. So keep an updated list of who those who have a role to play is crucial to success. As time goes by, you could identify new ideas about what works to turn the curve, maybe from research of similar projects nationally or internationally. Finally, remember to be flexible about the action plan, as new factors can be reasons to change it. Don't let the action plan be written in stone, and also remember that questions in the turn the curve thinking are not necessarily sequential. You can focus on any of the 5 questions as needed at any time. Remember, be dynamic. Now, once you have a plan, changes are to be expected. If part of the plan changes, you don't have to recreate the entire plan. Update your partners on what has changed and update only the portion of the plan as needed. Keep the change process as efficient as possible. Now that takes us to meetings. How do we make these RBA meetings efficient? The following approach will work well for all RBA meetings. Start by reviewing the turn the curve plan. Make changes to the plan as needed. The meeting agenda becomes the 5 core questions. How are we doing? What's the new data, if any? Is there any new information on the story behind the curve? Has there been a change to our partner list? Any new information on what we think works or what would work to turn the curve? Any changes to our strategy? And then end the meeting and adjourn. That is turn the curve thinking reflected in an efficient meeting agenda. Now I'd like to talk about the whole versus the part. The concept of accountability as distinct for either. We should pay special attention to the very important aspect of population accountability versus performance accountability. When we think about the whole versus the parts, the whole could be defined as the well-being of a geographic area or population. That's different from the accountability of an individual agency or program, or even service. So accountability for the whole, or accountability for the part, is how we make this distinction between population accountability and performance accountability. The latter applies to the agency, program, or service. The same principle can apply within an agency. In that scenario, the whole can apply to the whole agency, while the part, in that context, can apply to perhaps a specific department, unit, or program within the agency. But in general, when no other reference is provided for that type of scenario, the whole is referencing the accountability of an entire geographic area. The most significant part of this accountability principle is the concept of population versus performance. In other words, the whole versus the parts. Population and performance accountability is how we measure the well-being of communities, cities, counties, states, nations, or the world. I should say population accountability is how we measure the well-being of those. In essence, population accountability refers to a whole population. Performance accountability is how we measure the well-being of client populations, governments, multi-agency services, and organizations, programs, and business units. This distinction of accountability between population and performance enables us to be clear about how performance accountability should be used to determine how well organizations, programs, etc. are working to achieve the goals they can be held accountable for. As we've said before, individual organizations should never be accountable for whole populations. Keeping this in mind will allow us to avoid the mistakes of assigning the accountability and well-being of a whole population to any single program or agency. It's never valid to hold a single program or agency responsible for the well-being of a whole population. So now I'd like to talk about the accountability framework and language discipline. In order to do this work, we need a structured vocabulary, and we need to use language discipline. With discussions around performance and accountability, there can often be a lot of confusion or misuse of terms and terminology. People will often use a term that means different things or use different terms when describing the same thing. So turn the curve thinking will offer some standard terminology that, combined with language discipline, will help to alleviate confusion through the consistent use of terms. So a result is a condition of well-being for children, adults, families, or communities, as an example. An example of an indicator, a measure which helps quantify the achievement of a result, both applying within the domain of population accountability. We have results and indicators. For performance accountability, a government, service system, agency, division, program, etc. It can be any government system or organization or program or system, down to the smallest unit providing services and or resources to a set of customers. And then a performance measure would be a measure of how well a program, agency, or service system is working. So to summarize this, we use indicators for population results and performance measures for governments, agencies, programs, etc. So with turn the curve thinking, we use the indicators or performance measures to provide the data on how well we are doing. When we say start with the end, we always quantify or define that end with data. An accountability framework and language to be reviewed. We should now have a big picture of the accountability, the framework, and related language, and the concept of language discipline. If we put these concepts together for the population level, we will have results for our indicators, and we will be able to apply turn the curve thinking to the trend line of the indicator, which will be used to guide the development of our strategies. Our strategies will consist of a combination of governments, systems, organizations, or other programs, with each having its own performance measures. This approach supports organizations to perform these strategies in such a way as to impact their own performance measures through turn the curve thinking as guided by each specific strategy. Then all organizations together or cumulatively executing their individual strategies, which are aligned with the whole population indicators, are what turns the curve on those indicators. So there's a very important distinction here, and that is that we don't use indicators as performance measures for individual organizations, governments, or programs. So we are always drawing this distinction between the two different discussions. Population performance, and when we talked about a population result, we will ask what are the right things to do to turn the curve on the indicator. This requires joint accountability among partners or stakeholders. When we know what our roles are and what we're going to do, then we ask each partner or stakeholder what is their role and what their performance measure will be. What will each performance measure be, and how do we use performance measures to know if we're doing things right? So again, there are always two different conversations to support each other. As the head of an agency or someone who administers a program, when I'm having a conversation about my own agency and what's the right things to do, or then it's great to be an advocate of my agency to help us improve. But when I'm having a conversation about the population level, I wouldn't advocate for my program necessarily. Instead, I'm interested in what the right things to do would be for the population. Similarly, these concepts apply for local, state, or even national governments in those situations. Work to understand what the specific performance measure is for and the government entity, and then ask collectively, what are the roles the different government agencies play? Then ask, what are the right things to do collectively to maximize the performance of those government agencies? When you're done, ensure that each government agency has its own performance measure to match their role at that level. If we're talking about a scenario of multi-agency services, turning the curve happens when each agency cumulatively works to maximize its own performance measures, which in turn and as a whole improves the performance of the whole government. To be clear, this scenario of multi-agency services could be ones in which a human services system, early learning or child welfare system, or even a combination of agencies have individual performance measures based on the questions of what are the right things to do and are we doing those things right. This principle can apply at multiple levels, with the most important being population versus performance. So, a multi-agency service system and its performance measures support multiple agencies sharing joint accountability for the services system. Performance measures for the whole. This is performance. And then each agency is accountable for its own role and performance measures, its part, wherein each service systems agency and its performance measures are answering the question, are we doing those things right? Is an agency multiple units, divisions, branches, programs in an agency share joint accountability for agency performance measures for the whole? And then each unit, division, branch, or program is accountable for its role and performance measures, its part. Okay, so now let's talk about selecting results, indicators, and performance measures. So a population result can be about a population or a subpopulation. It can even reflect well-being for a geographic area. And it's important to emphasize that a population result will quantify a condition of well-being. A few examples of how we can define a population or subpopulation are shown here. All residents, all children prenatal to 5 years old, all seniors, people with developmental disabilities, African American males. Or a population can be defined as any type of population or subpopulation within a geographic area. New Zealand, a neighborhood in New York City, even a school catchment area. Conditions of well-being should be a statement that uses plain language, such as all people in New Zealand are healthy. All children in Maryland enter school ready to learn. All people in Belfast are economically secure. Here are some tips when selecting population results. Start by putting the results into a sentence, such as, we want all children in Jacksonville to feel safe during and after school. Or we want to live in a city where everyone has access to environmentally friendly parks. Remember to use simple, plain language. Avoid referencing data or improvement. In other words, don't say that you want to improve something. Just focus on a condition of well-being. Avoid referencing services and think of them as a means to an end. For example, we wouldn't say that we want an efficient social services department, because that's not a result. It's actually a means to an end. Instead, a true result could be found by asking, what condition of well-being would an efficient social services department produce in the population? Indicators. All right. Here we have examples of health indicators. All people in New Zealand are healthy based on the percent of low births and babies or mortality and morbidity rates. Safety indicators are defined through crime rates in Johannesburg. A school readiness indicator could be based on an assessment tool. All people in Belfast are economically secure, and we quantify the percent of youth not in education or employment training may be indicative that they are not economically secure. All people in Canada have a clean environment as defined by air quality rates. These are all good examples of population indicators. So it's important to have a criteria for selecting indicators. What is that criteria? And remember, when we use it, that less is more. The fewer the better. We really don't want more than 2 or 3 indicators for any given result. Remember, these are the metrics for our population results. So pick the most important 2 or 3. For communications power, does the indicator communicate to a broad range of audiences? Can people understand it? Keep it simple. Proxy power is a way to measure something essential. This is something referred to as importance power. Does the indicator say something of central importance about the result? Does the indicator bring along the data herd? Does it lead the herd? If we only select a few, do they take us and other indicators in the right direction? An example might be education or grade level reading, because if those are doing well, then our other measures such as school attendance or the quality of teachers are likely to be moving in the same direction as well. So you could say that grade level reading was leading the herd. And then what about data power? The power is defined by asking, do we have quality data available on a timely basis and for the targeted population in the targeted geographic area? So we should choose our headline indicators by assigning a value to each of our criteria of communication power, proxy power, and data power. You can start by listing the candidate indicators. Rate each for the 3 criteria, assigning either a high, a medium, or a low score. For any indicator that rates high on all criteria, then that is a good candidate for your headline indicator. Also note that if you get a low on data power, that measure or indicator is a candidate for data development. I should say a data development agenda. Okay, now let's discuss performance measures. Performance measures are made up of 2 sets of questions: quantity and quality, effort and effect. We combine those and we can ask questions like, how much service did we deliver? How well did we deliver it? How much change did we produce? And what quality of change did we produce? When we combine these concepts, we have 3 types of performance measures: the how much, the how well, is anyone better off? So who are our customers and what services did we provide them would be an example of how much did we do. Basically, we're answering quantity questions such as how many and how much. Quality, how well did we do it? For example, we're answering how well do we provide those services. And then is anyone better off type questions are the most important. These speak to the effects of efforts. Really, we're asking what is the desired impact of those services on our customers, the customer results. And note that these are customer results as opposed to population results. When selecting performance measures, we will have 2 types of quantification. For how much did we do, quantity, effort, and effect are graphed to create trend lines with using simply a numeric value. These can also apply to some of the is anyone better off, when we are on the quantity or effect quadrant on the lower left. And for our quality measures, we'll use a percentage value for both the quality effect, upper right, which measures for how well did we do, and for the lower right quadrant of quality and effect, showing results for is anyone better off. Let's consider a drug and alcohol treatment program. Quantity would be the number of persons treated. Quality would be how well did we do it in terms of the percentage of staff with training and certifications needed to do the work. Is anyone better off would be measured as the number of clients off of alcohol and drugs for a year, or the percent of clients off of alcohol and drugs for 1 year. Another example could be education. How much did we do? The number of students. How well did we do it? Student-teacher ratio. Is anyone better off? Number of ninth graders who graduate on time and enter college or employment after graduation, and then percent of ninth graders who graduate on time and enter college or employment after graduation. Here we see an example of performance measures for a fire department. The how much did we do? Number of responses. The quality, what's our response time? How well did we do it? Is anyone better off? Our quantity effect would be the number of fires kept to room of origin. Our quality effect, the percent of fires kept to room of origin. So for all measures, it's important to understand that how much did we do is the least important measure, but it's often a basic metric needed to accurately determine the most important measure, which is anyone better off. In the middle of the spectrum, and yet still very important, is the quality of services measure. How well did we do it? In most instances, what we find is that the measure of is anyone better off, while the most important is often the measure we have the least control over. The question of how much did we do, which is considered the least important, is one where we will have the most control. So leveraging partnerships where we have the least control can help to address this quality effect. For example, an after-school program may need collaboration with the school system, nonprofits, and even busing services. So partnerships are always important. Now let's discuss the criteria for selecting headline performance measures. Remember, less is more, maybe 3 to 5 at most, and we use the same selection criteria as we use for headline indicators. So does the performance measure communicate to a broad range of audiences? That would be our communication power. Our proxy power, sometimes referred to as importance power, does the performance measure say something of central importance about the program? Does the performance measure bring along the data heard? And then data power, do we have quality data available on a timely basis? These are the same principles that we've seen before. Okay, we've seen this process before as well. Selecting headline performance measures. We list our candidates' performance measures. Determine their value as low, medium, or high. If some receive a rating of high on all 3 criteria, they become candidates for headline performance measures. If any receive a high rating for communication and proxy power, but a low for data power, then they would be candidates for a data development agenda. So that is the process for selecting the headline performance measures. Once we have population indicators and performance measures, we then use them in the turn-the-curve thinking process, which creates a comprehensive framework from well-being of whole populations to the performance of individual units in an organization. So to summarize today's discussion, the key elements of RBA are turn-the-curve thinking, accountability for the whole versus the accountability for a part, population accountability versus performance accountability, and selecting results, indicators, and performance measures. And don't forget the importance of using language discipline to use the correct terms consistently. Results-based accountability is a disciplined way of thinking and taking action that can be used to improve the quality of life in communities, cities, counties, states, and nations. It can also be used to improve the performance of individual programs, agencies, and service systems. It starts with the ends in mind and works backwards, step by step, to define the means, always basing results in data. And so I would be happy to take any questions or comments at this time.